we have conducted some studies in these novel platform of mouse models generated from these patients showing resistance on osimertinib, and then trying to do combination studies and biomarker efficacy, and then also other studies, so that actually these are refining how the patient should be treated in future, suppose they come back with a similar type of osimertinib resistance. So what we are showing here is that we have a panel of these models that we have built, and then we are using them to actually conduct these studies and then actually help refine strategies, either to extend the duration of responses to osimertinib, or actually in the case of resistance, we are also trying to see what additional combinations can be done with osimertinib, so that actually the patients can have a wider population of patients can respond to these combinations. And before we went on to do these combination studies, what we did was actually we did a molecular characterization of these models and then tried to show that these maintain fidelity to the original patient tumor in terms of molecular characteristics. And further, we also tried to do efficacy studies with osimertinib, and we have shown that the patients who have actually shown response in the clinical trials are actually the models derived from those patients are showing really good responses, and then the patients who did not are not showing responses. So it's kind of characterizing them, showing the fidelity of these models, and then using them so that we have a better possibility of success in future to use these models and make an impact on the for these patients who are actually coming back with resistance on osimertinib.